But what has been the interesting thing about business that you were not expecting, baby?
Oh, wow. Well, from the aspect of Florida, Hurricane Milton.
What's up, guys, and welcome back to the Paper Jacket Podcast. In today's episode, we talk with Dr. Kelly, who is a dental surgeon here in Orange City, Florida. But there's so much more to her being a dental surgeon that you're going to want to hear about. She is probably the biggest hustling doctor, medical doctor, dentist I have ever talked to. You're going to want to hear all the services she has to offer and the expertise that she brings to the table on helping you have a very healthy life. Stay tuned. How you doing? Thank you for joining our podcast today.
Thanks for having me.
So I want you to let our audience know exactly what you do. I know you're a surgeon, but that could be many different types of surgery. So
yes, absolutely. So my name is Dr. Shaunda Kelly. I am an oral and maxillofacial surgeon, and I practice in the Orange City, Florida area. The name of my practice is Surgical and Sleep Solutions. We do a variety of procedures and services there, anywhere from solutions for sleep apnea for patients who need an alternative to CPAP machines, to full mouth rehabilitations with dental implants and coming out with a new smile and in one day with fully delivered dentition, new teeth and new confidence and ready to go out there and change the world. We also do dental implants. We do wisdom teeth and just a variety of things that services that patients need and that they're referred to us from their physicians or their dentist.
So help me understand how dentistry works with sleep apnea for a moment here.
Sure. Well, so sleep apnea is a very, very prevalent disease and condition in our society in America. And sleep apnea is basically when you're sleeping at night, you either have a partial cessation of breathing, which means you basically don't breathe for a few seconds, or you do a lot of heavy snoring where the air doesn't get from your mouth or your nose down to your lungs. And so if your body doesn't get air, you're not getting oxygen. And so that is a significant detriment to our health because we're not oxygenated. We wake up with headaches, we're tired during the day, we have excessive sleepiness, we can have irritability, and so it affects our mood and so many different effects that it has on our organs. Actually, it affects every organ of our body.
Right.
Sleep is the foundation of your health. If you don't have sleep, you don't have anything. Yeah. And so the number one treatment, the most common treatment for sleep apnea is a CPAP machine. And that's basically a machine that where you wear a mask and air is blown by a certain amount of pressure to keep your airway open so that oxygen can be delivered to your tissues at night. The downside of that is not everyone can tolerate a CPAP machine at night. Some people are claustrophobic or some people just can't keep it on. It can be too noisy. It can be uncomfortable. It can dry your nose out. And so there are alternative solutions to a CPAP machine if you qualify for it. And so in my clinic, we evaluate patients for the alternative therapies, which are one of two things. One is an oral appliance, which is a mandibular device that you wear. It's customized to your teeth that holds your jaw forward in a very comfortable position that you can tolerate. And you can actually get oxygen at night because when you hold your jaw forward, basically you'll be able to get your airways open. Yeah. The second thing that we also prescribe or, provide for sleep apnea patients is the Inspire device. And that's basically a nerve stimulator where it basically helps pull your tongue forward at night when it detects that your body or your tongue is following to the back of your throat at night. And so that helps pull everything forward, again, to open the airway at night.
How did you get into this? Because this is the first time I've ever heard about this. So the new procedure of the CPAP machine. Yeah.
So really back to the beginning, I was inspired to go into dentistry in itself by my father, who
was a dentist.
Well, actually, he was a professor. He has his PhD in finance management and marketing.
Interesting.
My father was from the Bahamas, a small island called 𝗃𝗄𝗃, and when he came to this country, he wanted to be a dentist. So he gave me that inspiration. Even though he went to another path, I took that mantle, and I just know that I'm where I'm supposed to be. Very passionate about what I do. And I just love waking up every day and helping patients achieve a better quality of life, and just achieve their dreams and their goals, because there's so many things that dentistry and even my background in medicine that I'm able to help people in so many different areas of their face, their jaw, and again, sleep and their overall general health. So many people don't really understand that their oral health affects their overall general health. You can get many infections. You can your teeth and your gums, the diseases that they can carry and can affect your other organs, particularly your heart and your brain. And so, controlling in any processes in your mouth can, make things a lot easier.
Before the podcast, you were sharing how you're doing a lot of traveling almost around the Central Florida area.
Yes.
You have multiple locations?
Not at the moment, but I'm mainly practicing here in the West Central Florida area.
Gotcha. Okay.
Yes.
Okay. So ultimately the Volusia County area?
Yes.
Okay. Very cool. Very cool.
Yes. Yeah, we're in Orange City, so very convenient to DeBary, DeLand, and Deltona. So we serve a lot of veteran patients as well. So proud to be a community care provider for our veteran population. That's my background, my history. So I definitely love to give back to those who have served our country. Also serve many patients from the Port Orange and Lake Mary, Sanford. We really pull from all areas around.
Being a specialist as you are, yeah, definitely. Oh, well, what made you decide on the Volusia County, Orange City area?
I just think, it was just opportunity, and God just led me here. And so I just like to follow the calling.
Good. Kind of going toward dentistry and all that, but you went toward a more specific niche, it seems.
Yeah.
What brought you there?
Well, I think just basically the needs of our community. And I think there with our community being, very diverse, but we do have a aging population in this area. And, I wanted to really, dive into where could I make the biggest difference.
Yeah. And ultimately, how long have you been doing this in Orange City?
In Orange City, I've been here going on 3 years, but I've been practicing oral and maxillofacial surgery for over about 16 years now.
Wow.
Yes.
Congratulations.
Thank you.
Good job. So where were you before this then?
I did practice in Tampa, Florida. And prior to that, I was practicing in Birmingham, Alabama, where I was the chief of oral and maxillofacial surgery at the VA hospital. I was teaching residents and a faculty at the University of Alabama. Roll Tide.
You can't say that around here. It's kind of Gator County, right?
I might get in trouble.
So you're very right about the sleep apnea thing, by the way. And I've always kind of feared as I've gotten older of I'm sure the CPAP's in my future. It's with my brother. It's with my father. And I'm sure it's in my future. But I'm the last thing I ever want to do is wear a machine. So sure. Let's talk about it a little more. How long has this existed, and what is usually the process of going this route?
Yeah, so it's been around for quite many years. I would say greater than 25.
Oh, wow.
I actually trained when I was in residency on how to deliver these devices. Generally, you're referred either by a sleep apnea physician, like a pulmonologist or an ENT specialist that has diagnosed a patient with sleep apnea. So the first step would be to get a sleep test done. And a sleep test can be either done in a lab, or it can be done at home, which is called a home sleep test. And that's where you wear some electrodes, or you may wear a watch or a probe on your finger to measure your oxygen saturations during the night. And then the test is read by a sleep physician. And from there, you begin any therapy that is the therapy that's recommended to you by your physician. Sometimes patients, if they have mild sleep apnea or moderate sleep apnea, they fit into the qualification or the category to get the oral appliance. Some patients with severe sleep apnea, we may need to try the CPAP first. And then there may be some patients that tried the CPAP and it just didn't work. And so, it's better to be treated than to be untreated. Right. And so I can't tell you how many patients that I see that have gone years without being treated, and they've had the diagnosis for many years. And so the awareness of this device, I think, is so important, because just because you're unable to wear your machine doesn't mean there's not another option for you. And so it really, hurts me when I see people, suffering or just not able to get the sleep that they need and know that their bodies are not getting the oxygen that they need. And they're affected in so many different ways. Most sleep apnea patients do actually have other illnesses. It's highly correlated with patients that have diabetes or may have some weight issues, obesity. And so all of these things basically are connected. And so, we want to control one, and then another. And then, usually, if you do that, things will start to fall into place.
So with you going this route of being a dentist, being a surgeon, everything like that, what made you think, all right, now it's time to be an entrepreneur within all this?
Oh, yeah, good question. So, after COVID, probably as so many people may say, I decided to come back home to Central Florida. And so my mom is still here. I was in Alabama. Yeah, I trained in Alabama at the University of Alabama, and I taught there for 11 years before I returned home. And so basically family drove me home, having young children and just wanting to be closer to mom and, being able to have a closer family ties, I think was really important at this stage of my life.
Yeah.
And so, I think basically once I came back, I was able to, work a little bit and just realize that, I wanted to do more. I wanted to build something, not just a brand, but build something that I could look back and be proud of.
Yeah.
I had gained so much experience as not just a professor, but just at the serving veterans and at the VA hospital. There were so many patients that I was able to serve and be able to provide care to that I just did so much. And so I knew I was equipped with the experience to come out into the community and just work as hard as I wanted to work and do what I needed to do to become my own business owner. And so I think being a business owner has been a good fit for me because I'm creative and I like to see good results. I like to deliver and I like to give good customer service all through, all while being able to be myself, deliver compassionate care and in a comfortable environment and apply all the principles that I learned from my background into a more personalized approach. And that's really what led me to become an entrepreneur.
So did you have a lot of these thoughts like while you were teaching, while we were in Alabama, throughout the years of like, if I had my place, I would do it this way, so on and so forth?
Yeah, absolutely. I do think that, when you're in one phase of life that you should live fully in it and take everything that you can take from that and use that to build onto the next step. I tried to hone all the skills that I could and to learn really the principles of business, even in a government institution. The principles are really the same, and I was able to, get a lot of experience administratively and clinically. And I think that really provided the foundation. And I knew I was ready when I was able to, accomplish certain things, programs that I implemented, having seen my residents go out there and build wonderful careers, and just seeing, all that I was able to accomplish from that academic standpoint, I knew that it was time to go out and do something else. So, So
I'm sure you have provided a great service, but what has been the interesting thing about business that you were not expecting, baby?
Oh, wow. Well, from the aspect of Florida, Hurricane Milton. Hurricane Milton. I opened my practice in 2024, at the beginning of 2024. And by October, this thing called a flood came in and really kind of wiped us out. And so we had to rebuild after just being open for 10 months. So, so when you're a business owner, you definitely are going to have challenges that are certainly unforeseen. But I think the resiliency that, is really within me, it comes out. Like, you just know that you get knocked down, you got to get back up. Secondly, I really found a lot of strength in our community. I had doctors that offered to help me, my colleagues that, I had been interacting with during that time period who offered for me to come into their offices. And so I'm so grateful to many doctors that helped me, Dr. 𝗲𝗲𝗍, Dr. Chen, Dr. Cologne, so many doctors, basically offered to help me get back on my feet. feet. And so, yeah, that was definitely unexpected. I would say that was the biggest thing that happened that really was like, okay, how do you handle this?
Funny you mentioned, we just had Dr. 𝗃𝗍𝗃 actually
You did?
on a recent episode.
Awesome.
Yeah.
Yes,
And,
yes.
he even shared about talking about he just wants to be a staple in the community. So it sounds
Yeah.
like he's already just
He
little cool
is
story about
wonderful
that.
dentist, good man. And
Yeah.
so definitely blessed to have met him and know him.
So as we kind of wrap up the episode, I would love for you to kind of share like how can other physicians ultimately know who you are to be able to refer you, but ultimately just anyone who's looking for implants, the sleep apnea solution possibly. How can people contact you?
Well, sure. We are located 400 Tremont Drive in Orange City. The easiest way to contact us is to email us at info@surgicalandsleep.com, or you can call us at 386-837-1236. And we're pretty responsive. We have a Facebook page. We have an Instagram page. You can DM us. And we're pretty much always available. I'm also a physician at the Advent Health Fish Memorial Hospital. So I was recently credentialed there. Yes. So you can also find me. I am now an Advent Health doctor, so very proud and thankful to the Advent Health team for welcoming me on, excuse me, and just really, opening their doors so that I can, again, have a broader reach, serve the community. Physicians are now able to, have better access to me. If you've been in the emergency room, and I'm getting referrals from the emergency room doctors, or, I've recently helped some of the patients in-house that have needed, the services of an oral and maxillofacial surgeon, So, I just think that the community has been very receptive to me being here. And it's just, a great, I think, addition to, making our community having a whole health approach to healthcare, because again, the oral cavity is the beginning of the GI tract, right?
Yeah.
It's a part of our bodies, and we just want to, make sure that we keep ourselves in the healthiest condition that we can for, what we need to do in our lives, and to be there for our families, and to lead a really good quality of life.
Definitely want to promote a lot more prevention care
Absolutely.
rather than just healthcare.
Definitely. I don't like to do just reactionary defensive care. You want to be proactive about your health, getting your cleanings with your dentist twice a year, because I can't tell you how many patients that I get that go to their dentist and they're referred to me because they need a higher level of care. They need a biopsy for a spot that's been found, or, dentists also screen for sleep apnea. Many dentists do that, and they may be able to help get your referral into a provider like myself. And, even patients that have infections in their mouth, they don't even know they have infections because they're silent. So just because you don't have pain doesn't mean that it doesn't need to be addressed. So definitely, you can catch things early. It really does help to prevent more complex problems from developing.
Absolutely. Thank you so much for being on our podcast.
It's my
Dr. Kelly.
pleasure. Thank you so much.
Toast to you. Cheers.
Cheers.